Imagine a ticking time bomb inside your head waiting to explode at any moment. This is the reality for millions worldwide living with the risk of stroke. Silent, swift, and often sudden, strokes are a global health menace that spare no one. They shroud our brains, threatening to strike when least expected. Yet many remain unaware of their lurking presence. The impact of strokes is far-reaching. They affect individuals, families, and communities. But what exactly is a stroke? Let's unfold that mystery in the next scene. A stroke is not a mystery, but a medical condition that occurs when blood flow to an area of the brain is cut off. When this happens, brain cells are deprived of the oxygen and nutrients they need to function, leading to cell death. This can result in various disabilities depending on the region of the brain affected and the extent of the damage. Now, let's dive into the two main types of stroke. Firstly, we have ischemic stroke, which is the most common type. This occurs when a blood clot blocks the blood flow in the brain. Secondly, we have hemorrhagic stroke. This happens when a blood vessel in the brain bursts, causing bleeding in the surrounding tissue. Understanding these types can help us in identifying the possible triggers and how to respond accordingly. The causes of strokes vary, but certain factors can significantly increase the risk. So let's delve into these risk factors in the next scene. From age and lifestyle to medical conditions, various elements play into the risk of having a stroke. High blood pressure, often referred to as the silent killer, is a primary culprit. It damages blood vessels over time, making them prone to blockage or rupture. Smoking, too, is a significant player. It reduces the amount of oxygen in the blood, causing the heart to work harder and increasing the risk of clots. Then we have diabetes and obesity. Both of these conditions can cause damage to blood vessels, again increasing the likelihood of a stroke. Age is another factor we can't ignore. While strokes can occur at any age, the risk doubles for each decade after the age of 55. Lastly, let's not forget genetics. If a close relative, like a parent, grandparent, or sibling, has had a stroke, your risk may be higher. So how can we prevent strokes? It's all about taking control of these risk factors. Taking steps towards a healthier lifestyle can significantly reduce the risk of stroke. It's like preparing for a marathon. You don't just wake up one day and run. You train, you build your stamina, you eat right, and you rest. Similarly, preventing a stroke is a long-term commitment that requires consistency and dedication. Let's talk about some of these marathon-like steps. First, regular exercise is a must. It's not about becoming the next Olympic champion, it's about staying active. Whether it's a brisk walk in the park, a 20-minute yoga session, or an intense workout, find what suits you and stick to it. Next, a balanced diet plays a crucial role. Incorporate more fruits, vegetables, and whole grains into your meals. Limit your intake of saturated fats, cholesterol, and salt. Think of your body as a high-performance machine. You wouldn't want to fuel it with low-quality petrol, would you? If you're a smoker, quitting can significantly lower your risk. I know it sounds easier said than done, but remember, small steps can lead to big changes. Reach out to support groups or consider nicotine replacement therapies. Managing medical conditions such as high blood pressure, diabetes, and heart disease is also essential. Regular checkups and following your doctor's advice is the key here. Recognizing the signs of a stroke can make a world of difference in recovery. The journey towards prevention starts with understanding, so let's keep this conversation going. Time is brain. The sooner a stroke is recognized, the better the chances of recovery. When it comes to stroke, knowing the signs can make all the difference. The most common symptoms are sudden and distinct. They often include a severe headache, difficulty speaking or understanding speech, and sudden numbness or weakness, especially on one side of the body. Imagine you're having a normal day and suddenly you feel a sharp pain in your head, unlike anything you've ever experienced. Your speech becomes slurred and you can't seem to lift your arm. These are telltale signs of a stroke and they demand immediate attention. Remember, strokes are medical emergencies. Don't hesitate to call for help. Speed is of the essence, and every second counts. It's crucial to get medical attention as soon as possible to limit the damage and increase the chances of a full recovery. Stroke is a serious condition, but with the right treatment and support, recovery is possible. Every stroke survivor's journey is unique, but hope and recovery are universal. After the storm of a stroke, the road to recovery might seem daunting, but it's important to remember that you are not alone. Modern medicine offers an array of treatment options, from clot-dissolving drugs to rehabilitative therapies aimed at regaining lost abilities. Rehabilitation is a crucial part of recovery, a journey of relearning and adapting. It encompasses physical therapy to regain strength and balance, occupational therapy to relearn everyday activities, and speech therapy to address communication challenges. But beyond the physical, recovery also means emotional healing. The support of loved ones, medical professionals, and fellow survivors can be a beacon of light in this journey. Support groups and resources are invaluable, providing a platform for shared experiences, encouragement, and advice. Remember, each step you take on this road, no matter how small, is a victory. Together, we can make a difference in the fight against stroke. You are now armed with knowledge, the most powerful weapon in the fight against stroke. This knowledge is not just for you, it's a beacon of hope and a lifeline for those who are not aware of the silent threat that stroke poses. It's a tool for empowerment, a way to take control of your health, and a means to inspire others to do the same. So, let's not keep this knowledge to ourselves. Let's share this video far and wide. Let's start conversations about stroke prevention and recovery. Let's debunk myths and dispel fears. Let's support those who are on the road to recovery and remember that no one fights alone. Knowledge is power, but only when it's shared. So share this video, talk about it, and let's bring stroke awareness into the light. Join the movement, empower others with knowledge, and let's strive for a healthier tomorrow.